Good afternoon. Several public health updates for today, but first the numbers. We are announcing 323 new infections, new people diagnosed with COVID-19 today. 270 of these are people who tested positive by PCR and 53 by antigen testing. In the last week, we have now averaged about 240 new infections per day statewide, which is up from where we were last week. Currently, there are 2,528 people with active infection, and the 14-day rate of new infections is at 178 per 100,000 population. Both of these numbers are increased from last week as well. Our PCR test positivity rate is at 2.6%. And there are 4 new people hospitalized with COVID-19 that we are announcing today, and 64 people currently hospitalized statewide. There are 3 new people that have died from COVID-19. All 3 of these individuals have been and are associated with long-term care facilities, bringing the total number of people that have died directly or related to COVID-19 to 495. This pandemic virus is now widespread in our state. The number of infections is also increasing. The hospitalizations are increasing. The test positivity rate is increasing, and the number of people dying from COVID-19 is also increasing, which is reflected in the changes in the numbers that we have been reporting out here on a weekly basis. All counties in New Hampshire and the state as a whole is now at a substantial level of community transmission. And we know that as community transmission increases, the risk of COVID-19 to individuals, to schools, to businesses, to communities will also increase. But we know, I want to stress again, that we know how to control spread of this virus. We have seen our community mitigation efforts pay off and work in the first wave of the pandemic and over the summer when rates were low. But controlling spread of COVID-19 continues to be a collaborative and collective effort. Public health alone is not able to control spread of this virus without the buy-in and the help from individuals and businesses and organizations and communities. Given the high rates of community transmission, we want to announce, and I'm going to hand things over to the commissioner in a minute, but want to introduce the change that public health will no longer be conducting contact tracing investigations for each and every person diagnosed with COVID-19. Instead, we will be prioritizing who we investigate and targeting our public health resources to those individuals in those situations most at need and most at risk for spread of COVID-19. We will also be working with and empowering our local partners, the individuals themselves with COVID-19, to help with outreach and help do some of the contact investigation. So we want to stress that if people do get called by public health, please pick up the phone and work with our investigators to help identify people who may have been exposed to COVID-19 and are at risk themselves. This is going to continue to help protect businesses and schools and community organizations. But not everybody will be getting a call going forward from public health. So we are asking people who have been diagnosed with COVID-19, and we are asking our healthcare providers and local partners to help with the outreach effort and to help identify close contacts of people diagnosed with COVID-19 and provide them with the appropriate public health information and guidance. We will be posting more information on our website for our community partners. People can go to nh.gov/COVID-19 to find out more information. That we should have a post shortly directly on the homepage. I want to stress that contact tracing is part of a containment strategy to stop the spread of COVID-19, but it is one and only one layer or intervention for helping to prevent the spread of COVID-19. As community transmission increases, it becomes a less effective strategy at identifying and breaking chains of transmission. And so we need to, at this point, continue to rely on the community mitigation measures that we have relied on all throughout this pandemic to bring the second wave of the virus under control in New Hampshire. I'm going to hand things over now to the commissioner, and she's going to talk more about some of the details of the changes in contact tracing. Thank you.
So I think we're going to go directly to that, and then I'll back up and do a long-term care update when I'm done talking about contact tracing. So as we've said for several weeks now, one of the big obstacles in contact tracing is reaching the patients that have positive cases. Right now we're reaching about 40 to 50% of our positive cases on the first call. Because of that, we want to equip our providers, our physicians, nurse practitioners, our hospital staff with the tools to help everyone keep themselves safe and their community safe. And the way we do that, we know that the providers are talking with the patients because they're oftentimes delivering the positive COVID test result to the patient. So why they have them on the phone, we are going to ask them to give them basically a one-pager that we will be providing by public health that it basically gives them the isolation criteria, anybody in the household that's a close contact, asking them to quarantine, so they will be able to have that first point of contact with the patient and be armed with all the information they need to start breaking that chain of transmission, as Dr. Chan talked about. So some of the case investigations that we have typically done, we are going to start prioritizing those case investigations. So what you'll see on this slide are the people that we are prioritizing for a full case investigation. People under 18 years of age, people over 65 years of age, racial and ethnic minorities that are being disproportionately impacted by COVID-19, anybody associated with a cluster and an outbreak, congregate living settings, and healthcare workers. So we will start with these cases as they come into public health. And if we complete these, as our numbers go down, as we complete them, we don't stop here. We continue to go on and continue to investigate as many cases as we can through the day. But this is going to be our priorities. The expectation, and it really has been all along, people are told that they're positive for COVID-19 usually by their healthcare provider. That's the first call that they always get. Unless they get a rapid test, then they're told immediately. So that will still happen, and their providers will be given the information to hand along to the patient to start the isolation and quarantine process. So Dr. Chan will be issuing a health alert to his provider colleagues tomorrow with the directions around the new contact tracing plan. So now to back up for long-term care update. Today we are announcing 3 new outbreaks. Coos County Nursing Hospital with 26 residents, 33 staff. The New Hampshire Veterans Home with 9 residents and 2 staff. And Prospect Woodward Home at Hillside Village in Keene with 8 residents and 2 staff. We are closing 1 outbreak at Bedford Hill Center, which closed on 11/9/2020. All counties are currently in a phase 1 when it comes to visitation. One other public announcement that I wanted to make, in the last 2 or 3 days, we became aware of 4 instances of potential community exposure at polling locations on Election Day. Those community exposures were at Souhegan High School, Pembroke Academy High School, Belmont High School, and Newfields Elementary School. These were all people that identified in the last couple of days of having positive COVID-19 tests and reported being in line and not being able to 6-foot socially distance while being in line. So our public notification today is anybody that was at a polling station, specifically those 4, but really anybody based on our rate of community transmission right now, if you were in line at a polling station on Election Day, that you really need to be monitoring for symptoms of COVID-19. That's all I have. Thank you.